Thank you for having your pet spayed or neutered. You've become part of the solution to the animal overpopulation problem. You're taking your pet home, and there's some very important post-op instructions you need to follow. We'll go over these now, but you'll also have a printed copy with your paperwork, so pay attention. There will be a test. Well, not a real test, but your pet is depending on you to follow these directions carefully. Of course, if there are any questions or concerns directly related to the surgery during the recovery period, please call our clinic at 559-271-0209 or refer to the written instructions given to you at the time of drop-off. To help your pet have a speedy recovery, please follow these easy instructions. The best place for your pet for the first 48 to 72 hours is inside, where they can stay clean, warm, and dry. Pets can't control their body temperature during this time, so they could develop heat stroke or frostbite if temperatures are extreme. Dogs should only go out on a leash. No running, jumping, playing, swimming, or other strenuous activity for 10 to 14 days after surgery. No baths for Fluffy for 2 weeks. If you have a feral, stray, or outdoor cat, try to keep them in an enclosed environment such as a barn or a garage for a day or two before letting them back outside. Check the incision site twice daily. What it looks like today is normal. Some bruising is expected, but redness and swelling should be minimal. There may be some discharge, but it should be clear, straw-colored fluid, possibly with a pink tinge, but no obvious blood. If you notice any foul-smelling discharge or bright red discharge, please call our office. If you had your adult male dog neutered, especially if he's large, the loose skin where his testicles used to be will swell. Please be sure to keep him calm, confined, and restrict activity for 10 to 14 days after surgery. We highly recommend purchasing post-operative pain medication from the clinic that also reduces swelling. Do not use human medication on your pet. If your female dog was in heat today, you must take extra care to make sure she is not around males for the next 2 weeks, as she may still be attractive to males and may even still have discharge during this time. If mating were to occur, it could cause her serious internal damage. This is more critical with dogs than cats, but be careful all the same. Do not allow your pet to lick or chew at the incision. If they do, an e-collar must be used for your dog. Buy one now for $15 if you know your pet's a licker. This is for their benefit. They may look pitiful, but they'll appreciate not having to come back to get a swollen incision checked out. Your pet's sutures are internal, so there's no need to bring them back to have them removed. The surgical glue used to close the outside layer of skin will dissolve as the incision heals. Warning: graphic images. Turn your head if you don't want to see. These are not normally healing surgical sites. If your pet's incision looks like this, call us immediately. Okay, gooey grossness is over. Back to your regularly scheduled post-op instructions. When you get home, offer your pet a little water first and then a few bites of his or her normal food. Appetite should return gradually within 24 hours. Do not change your pet's diet, and don't give them junk food, table scraps, milk, or any other people food because it could mask other problems. Don't go to McDonald's and get Spot a Big Mac as a treat for being a good boy at the doctor. Dogs may have a slight cough for the next few days from the breathing tube used during surgery. Be on the lookout for these important symptoms: lethargy or depression lasting for more than 24 hours post-op, pale gums, diarrhea or vomiting, discharge or bleeding from the incision, difficulty urinating, or labored breathing. If you observe any of these signs, please call our clinic at 559-271-0209. If it's after hours and you feel your pet is experiencing a life-threatening emergency, please contact your nearest 24-hour veterinary emergency hospital. Remember, H.O.P.E offers free rechecks on surgeries performed at our clinic. So if you think your pet is having a surgical complication, feel free to return to the clinic between 10 a.m. and 4 p.m. Monday through Thursday, and we will take a look free of charge. You do not need an appointment for a recheck. You will see a small amount of colored ink on your pet's incision. This is their tattoo, and no, it's not mom in a heart. It's a little colored line on their belly. This is a common practice to identify sterilized animals. The glue used to seal the tattoo and skin will flake off. Don't rub, scrub it, or wet it. If an initial vaccine was given today, one or more booster vaccines may be needed in 3 to 4 weeks to fully protect your pet. You can do this by visiting us during our walk-in vaccine clinic Monday through Thursday from 10 a.m. to 3:30 p.m. or by visiting your regular veterinarian. If your dog or cat received a dosage of deworming medication after surgery, please note that some loose stool can occur as the medication passes through the intestinal tract, killing any parasites that may be present. Some parasites may be seen in the stool after the medication is given. If this occurs, it shouldn't last longer than 24 hours. An additional dose of deworming medicine may be needed. All dogs and cats have received pain medication to help them through the next 12 hours. Many pets do not show signs of pain, but benefit from several days of pain medication post-op. You are welcome to purchase this at the clinic for $10. Please give it to your pet as instructed if you purchase this today. If your pet received a microchip, you will receive instructions on how to register it. There should be contact information for Home Again in your Go Home packet. Please be sure to register your pet with all the correct information and contact them if you move or change your address in the future to help your pet get home. Microchips with out-of-date information don't work. And remember that microchips are not a GPS tracking system. It works more like a barcode on a can of soup at the grocery store. It stores your pet's address so humans can help them get home. We hope your furry family member has a speedy recovery. Remember to call our number if you have any post-op questions. Non-urgent calls, including those pertaining to incision issues, will be returned the next business day. If your pet is experiencing a life-threatening emergency after hours, please contact your nearest veterinary emergency hospital. H.O.P.E Animal Foundation will treat at our clinic, free of charge or at reduced cost, any post-op complications resulting directly from surgery if the above post-op instructions are followed in full. Your regular veterinarian must address issues not related to surgery. H.O.P.E will not be held responsible for the cost of care that was not received at our facility. Please call our office as soon as you see cause for concern. Remember, following these easy directions will help your pet have a speedy recovery. And we can't be held responsible for complications resulting from failure to follow these important instructions or for contagious diseases for which the animal was not properly vaccinated. But if you've kept an eye on your pet's incision during the healing process, a post-op recheck shouldn't be needed. Before you leave, have you picked up Frontline Flea and Tick Preventive? Ask one of our front desk staff about your pet's doses today. Thank you again for trusting us with your pet's care today, and spread the word to help us reach more people with our programs at H.O.P.E Animal Foundation.